My name is Melanie Goodman Dante. I'm with SWOP Behind Bars and a graduate of Goddard College's Health Arts and Science program. I'm here today with Bella Robinson, founder and executive director of COYOTERI, Rhode Island, and we are thrilled to be here at the University of Toledo's International Human Trafficking and Social Justice Conference to present Understanding the Experiences of Sex Workers Within the Continuum of Healthcare in the United States. Bella, welcome. Thank you so much for being here today with me. I have some questions. Is that good?
That sounds great. Thanks for being here, Melanie.
Oh, you are so welcome. So Bella, you have a really interesting background that not all of the participants in this discussion might understand easily. So could you just tell us, how long have you been involved with the sex industry? And if you would like to add how you entered also into that, that would be fine.
Sure, great question. So I've been involved in the sex industry for over 35 years. I started at age 18. I was a child bride, married off to an older man at age 17, and found myself homeless on the street. So some other street people, and back in the day, we called them drag queens, that kind of taught me the ropes and were actually a huge asset as far as keeping me safe and not taking advantage of me.
It's a lot. Wow, thank you, Bella. Would you like to share with us now what inspired you to utilize your experiences to create this community-based research and the continuing medical education modules that we're going to be sharing?
Well, it started when I was in prison in Florida, and their health services were negligent at best. And then in the free world, dealing with medical professions, how safe did I feel disclosing this information and what was their reaction going to be? So what we did is we led several research projects. One of them was in 2017, where we asked over 1,500 sex workers across the country and people involved in the sex trade, trafficking victims, 145 questions. Our health and policy advisor wrote her thesis on the HIV and sexual health part. She went on to present at AIDS Conference Amsterdam 2018, Harm Reduction Conference in 2019. And then we collaborated with the St. James Infirmary to create a 3-module continuing medical education class.
That's an amazing amount of work. With that, you must have gained a new understanding of currently where there is the most vulnerability in the sex industry, especially at the intersection of the paradigm of sex work and sex trafficking. Based on your research, who are the most vulnerable?
Well, first of all, I want to say that race and poverty have much to do with this. So street-based workers might be less able to negotiate safety, condom usage, their rates. Trans women, especially trans women of color, are particularly targeted on the streets by law enforcement, whether they're sex workers or not. We also have migrant sex workers like Asian spa workers who have been heavily policed by ICE in a homeland, and even people in their community. There's also people that have mental health problems, that are disabled, that have substance abuse issues. So it really boils down to how poor someone is, as far as how much ability they have to negotiate and create safety for themselves.
So stigma and poverty, Bella, seem to go hand in hand. Is that correct?
Yes. Stigma, in my opinion, always increases violence. It teaches society that these are bad women who get what they deserve. They're lazy women. It never includes topics like poverty, the lack of affordable housing, the fact that who can live on $15 an hour, and where's Medicaid for all? And it seems that most of the funding through Congress goes to organizations that do not provide any direct services to people involved in the sex industry. But it does create a lot of jobs for some privileged people to promote the stigma and violence. And I'll give you one more example. We've all seen the defund the police and how police are over aggressive and they're murdering Black people in the street. But this is who we're sending out to investigate and police marginalized, vulnerable women. So how is that ever a good idea?
So you feel that having community-based research and participation as far as sex workers in the sex trafficking discussion will help to reduce domestic trafficking and the violence that has been exponentially increasing with the lack of services that are being offered, or at least that have been. I know in rapid time, communities are coming together to figure out resolution to a lot of the problems that are coming up. But do you feel that sex workers are a vital component to helping with this issue?
Absolutely. Sex workers could be the best tool we have to identify and protect trafficking victims. And our research showed almost all the cases where people identified have been trafficked or exploited in the past were already involved in the sex industry. They were not kidnapped and forced into dungeons. What happened is they got involved with a bad player or partner or boyfriend or coworker, and they couldn't report this violence or exploitation without risk being arrested themselves. So it's actually their criminalization that stops us from identifying more abuse in the industry.
Mm-hmm. Well, that's why I believe it's important to be presenting this discussion to healthcare professionals and the affiliated social and behavioral health professionals so that there can be more discussion of health and safety with people involved in the sex industry. Thank you for the contributions that you have been taking on your own. And if I understand correctly, you also have raised the money to be able to do this and have it here. Is that correct?
Yes, it is. We actually, Coyote has funded with the little funding we had. So most of this work was built off the backs of criminalized active sex workers and trafficking victims and survivors. But we felt that hearing their experiences, we had a lot of questions that said, tell us more in your own words. And I believe we have the biggest sample ever seen in the United States. And I think when organizing for any population, their voices and their experience, they're the experts. We have to listen to what they say and what they need and what they want their politicians to know. And they also need to be part of the policy process.
Sure. And I believe that that is something that the United Nations has been saying since 2015, that inclusion, individual inclusion, experiential inclusion is vital to the discussion to be able to offer as much health and safety for people involved in the industry. That said, you have a module, a video module to share with us here,
Yes, we do.
yes?
We're going to share it right now. Thank you.
Oh, you are very welcome. I turn it over to you.
Module will be moving into more of a clinical focus, and we'll be talking about best practices in caring for sex workers. And this will be focused for healthcare providers, and we'll be talking about some of the ways that healthcare providers can best address some of the barriers we talked about in earlier modules, and also get into best practices day to day. So some of the goals for this training include determining the best practices within your profession that promote the health and well-being of sex workers, evaluate how to implement these best practices clinically, and understand where to learn more and where to refer patients if you feel that your current understanding and the current resources you have available are not sufficient for your patients who are sex workers. So before we get into too many details, I just want to talk about how healthcare can be such a huge site of support for patients that are struggling in other areas of their life, and patients who are sex workers who are experiencing a lot of the isolation and stigma and criminalization that we talked about in earlier modules. In the survey of sex workers nationwide from 2017, one participant wrote, "Just being able to disclose that I was engaging in commercial sex could have been invaluable. I was completely isolated socially and didn't believe I could trust anyone with what I was living through." So this participant did not disclose to her healthcare providers that she was a sex worker, but like many other participants, this person felt that it would have been really helpful to be able to use healthcare as a site of support. And I think that as healthcare providers, we're in a very unique position to be able to provide support to someone, not only in their healthcare, but also in lessening their sense of isolation and helping them build a stronger foundation in other areas of their life as well. But before you're able to provide this kind of support, it's important to reflect on how your personal beliefs and values on sex work impact how you treat patients, and doing this reflection before discussing sex work in clinical interactions. And part of this is reflecting on how your personal beliefs and values on sex work strongly impact how you treat patients. This reflection looks different for every person and involves just really sitting with your own thoughts about sex work and about your patients who are sex workers. And if after this reflection you find that you still have beliefs and values that may be implicit or explicit that may negatively impact service provisions, there's still something you can do about that, which is being comfortable in the fact that you may not be the appropriate provider, that there may be another provider that could be better suited for this patient, and be ready to refer them to another provider. It's all right to know what your limitations are, and if that is a limitation, the best thing for your patient is being able to refer them to someone else. And if after reflection you feel that you're ready to engage with patients that are sex workers in a non-judgmental way, in a way that can make healthcare into a site of support, engaging with educational programs like this is a huge step. So thank you for coming and being a part of this training program, because professionals working in healthcare settings are able to confront the possibility of judgment within their own profession. The discrimination against sex workers within healthcare does not have to exist, and it's through reflecting upon your own beliefs and speaking to your colleagues, being ready to take on some of these challenging situations, that you're able to break down the judgment that may exist. And this allows for healthcare providers to move past this judgment and provide the most comprehensive, effective, and compassionate care possible. And again, before we get into more specifics, just a huge idea that is repeated again and again throughout this survey, and also will come up with most any patient who's a sex worker that you ask, is just to treat sex workers the way you treat other patients, to acknowledge their specific requests, their specific needs, but to treat them as you would treat any other patient, with respect and listening to what they need. And so this was mentioned earlier in the module, but building trusting relationships with patients who work in the sex industry is huge, because most sex workers will not be comfortable or have no desire to disclose that they do sex work if they don't trust their provider and if they don't feel that this information will be handled appropriately. And for this reason, discussions of sex work may not arise immediately. It shouldn't be expected that the first time you meet someone, they'll tell you that they do sex work, because that trust doesn't exist. And so there should be a big focus on building trusting relationships with all patients, and sex workers will only disclose if they know they'll be safe and receive health care even after they disclose. And in order to build this trusting relationship, ensure patients know that they will not be reported or judged for their involvement in the sex industry. And this can take a lot of forms. This can be verbally saying that in an interaction. It can also mean posting materials in your waiting room of the office that say exactly this, that patients that discuss sex work will not be judged or reported by putting up a poster of a sex workers' rights group that says that you stand with sex workers. There are a lot of ways to make it known that it is okay for patients to discuss sex work with you. And if you do bring up sex work during a medical interview, during taking a sexual history, you can use direct and clear language. You can ask during a social history when you're talking about occupations, when you're talking about income, or during a sexual history if you feel it's appropriate then. And direct language can look like asking the question, have you ever supported yourself or supplemented your income through sex work? Have you ever been involved in sex work? There are a lot of ways to ask this question, but I think the two I provided are clear and to the point, and patients will understand what you're saying. And again, a quote on building trusting relationships. Another participant, age 34, says, "Be patient if a sex worker tries to tell you their story because it signals they're beginning to trust you. If you cut them off or act indifferent, you will crush that trust, and you may not get another chance to regain it. Don't rush to conclusions." All important points. If someone is opening up, definitely give them the chance to discuss their work, discuss what they need to talk to you about, and know that if someone is disclosing to you, it means they already trust you, and that's trust that should not be taken lightly. Another huge area to touch upon clinically is confidentiality. Confidentiality is taken very seriously in healthcare settings, as it should be, and ensuring confidentiality with your patients that are sex workers is huge. Oftentimes in a social history or a sexual history, kind of in a short preamble, something that I always recommend is mentioning that all information stays confidential and will only be shared with other members of a healthcare team if it's absolutely necessary. And I would say that most times discussions of sex work should not be shared with other members of a healthcare team unless you have explicit confirmation from a patient that that is okay. And also, before taking any kind of notes or making any kind of record, I would recommend being transparent with the patient about what their options are as far as recording what they're talking about, and then allow them to choose and follow through with that. There are many providers that have an electronic health record and are also taking personal notes during a visit, and personal notes may just look like handwritten notes for their next visit or for them to remember in the moment. And so giving the option of, if someone mentions sex work, either not recording it at all, which is an option, writing it on a personal note versus an electronic record, because it is worth noting that if something goes on an electronic record, then it often is out of your hands, what happens to it next. And most sex workers would not want that information to be that widely accessible. So asking them how you want things recorded and saying that you don't have to record their occupation on any kind of record if it's not what they want. And also something important is being transparent about mandated reporting, because healthcare providers are mandated reporters, and saying that if someone touches upon the subjects of child abuse or elder abuse, that you will have to report that regardless of what a patient wants in that moment. And an example of how to approach recording and confidentiality in terms of sex work is thinking about the domestic violence framework, and that a lot of providers will not record domestic violence on electronic health records, but will keep separate handwritten records that are kept kind of even more confidential, because they feel that this information is very important to someone's health, and they as a provider want to be able to remember it and not have to have this conversation again and again with their patient once that trust is built, but they are not ready to put that on an electronic health record. And another huge thing that will come up again and again in regards to sex work is avoiding assumptions and addressing judgment. It's natural, and it is easy to make assumptions in any area of life. It is something that we do naturally and kind of has to be actively interrupted, but not assuming someone's experiences in the sex trade is huge, because as we mentioned, there are so many experiences that people have within the sex industry, and it's easy to assume one experience or another and move someone all the way positive or all the way negative in their experiences, when this is rarely the case. And you can only truly come to understand someone's relationship to their work and their experiences through listening to them, through building a trusting relationship and letting their specific opinions and feelings on their relationship to their work. And so don't make assumptions of a person's risk factor in relation to their work either. As we discussed, there are occupational hazards that may come up, but a lot of sex workers don't experience the kind of risk factors that people who are not sex workers may experience in their sexual lives. And again, discussing this with your patients is the only way to get a clear picture. And listen to sex workers to understand why they're accessing your services. It may be completely unrelated to sex work, and their work itself may not be important in their clinical presentation. It may be a job as any other job is. And so avoiding assumptions and avoiding judgment about the nature of their work comes into play, not only in being non-judgmental generally, but in providing effective care and providing care that does not fill in a blank space with assumed information instead of factual information. And as another participant writes, just listen to what your patient has to say. Try to understand, figure out what your patient is saying they need rather than assigning what you think they need to them. Sex workers are the same as other people seeking help. They will have job-related specific issues as everyone does, but are individuals. And when it comes to providing care options, this again is not specific for sex workers, but being able to provide a patient with options for their care, discussing what all of their options are, and then walking through making a decision about what's best for them with the patient is huge. When someone comes in asking about STI testing, discuss all forms of STI testing with them, not just HIV, and discuss their options for testing for HIV, how results will be communicated, but also discussing full STI panel with them and what their options are. Discuss comprehensive health needs and not just STIs and sexual health. It's easy to hone in on sexual health when someone discusses being a sex worker, but that doesn't mean that should be the focus or the only part of their medical visits. Prioritize what the patient is most concerned about. For many sex workers, their sexual health, again, won't be the primary concern or reason for the visit. And it's also key to provide patient education throughout a medical interview. It doesn't have to be immense amounts of education. It doesn't have to be highly structured and accompanied by all kinds of handouts, but just discussing the knowledge that you have as providers with your patients as it's relevant. And so in terms of STI testing, STI treatment, letting patients know what their options are and how they should go about making the best decisions and choosing the right treatments, the right practices, and direct patients to appropriate resources to learn more if there's not sufficient time during an encounter. Make sure patients know where to learn more if you're not able to go as in-depth as you would like as far as patient education. And the subject of patient autonomy is also discussed in a lot of areas of health, but comes up again and again regarding patients who are sex workers, because providing sex workers with options about what kind of care they will receive allows patients to make informed decisions about their health, to have agency in taking care of themselves and defining what they need and how they're going to go about getting that. For many patients, sex work will continue to be the only or best option in terms of economic stability. And while that's difficult for people who don't do sex work, have never considered sex work, to understand, to force someone out of economic stability can be disastrous, not only for themselves, but for their families, for their health, and for their ability to care for themselves. And so it's a challenging position to be in if someone talks about wanting to exit, but forcing them out of stability in the moment is not necessarily what's going to allow them stability long term and the ability to exit long term. And so don't force patients to exit the sex trade in order to be able to receive health care. If it's made into an ultimatum, either health care or doing sex work, that's forcing a patient to choose to receive care or to not have any form of income, not have any form of supporting themselves. And if a patient does express wanting to exit, refer them to the support services that they'll need in order to be able to exit. Being able to exit the sex industry is impossible if they don't have another option for generating an income, for supporting themselves and making sure that they stay stable. And often well-intentioned actions such as involving the police, forcing someone to file a report, forcing someone to self-identify as a victim in order to exit, may seem like the most straightforward options, but oftentimes are not giving someone the material resources that they need in order to have control over their lives and make decisions about their involvement in the sex industry moving forward. And as another participant says, just be nice to us and understand that we deal with an unbearable amount of judgment and stigma already and cannot handle any more side-eyeing or uncomfortable questions or unsolicited condescending advice. I don't want to lecture or your pity. I'm just here for medical care. Please don't make it any harder. Making the effort to be kind to patients and to address your own judgment before interacting with patients sounds so simple, but it goes such a long way in clinical interactions and will really set the foundations for having not only a good relationship, but being able to provide effective care. And additionally, when we talk about referring someone to other places for services, it's important to be aware of the specifics of where you're referring them, not only what that agency will be able to provide them or will not be able to provide them, but where they stand on sex work and whether or not they have any biases regarding sex work. And don't out a patient as a sex worker without their explicit permission when making a referral. And when referring to other agencies, try to select support services that are educated about sex work and will not turn patients away. And when a patient has experienced violence, understanding that police have been perpetrators of violence and it may not be safe for sex workers to file a police report is huge. And forcing a sex worker to encounter the police or to make a police report while in healthcare services is something that will very easily turn someone away at best, and at worst can put them in more harm's way. And again, meeting patients where they're at is huge. Approaching clinical interactions from a harm reduction standpoint can make a huge difference in being able to provide care that is sustainable and is effective for a patient. And mentioned this earlier, but not turning patients away for continued involvement in the sex trade is huge. Rolling with resistance is also something that providers should be ready to do. Patients may not be able or ready to make dramatic changes surrounding their health immediately, but meeting someone where they're at starts this process, and it's got to start somewhere. And scheduling follow-up appointments and following through with promised services is huge. If you're not sure if you can provide a service, but really want to be able to provide a service for someone, just say that you're not sure is always better than promising it and not being able to follow through with that promise. Saying that you hope another agency will be able to follow through with something is better than guaranteeing that another agency will be able to, because that being as honest with your patients as possible is often difficult because, we want to be able to provide everything and the best care possible. But as far as establishing a relationship, being transparent about the fact that something may or may not happen goes a lot further. And it's also possible to agency-wide create an environment that is stable and welcoming for sex workers. As we've discussed through all these modules, social isolation can be very dangerous for someone's health and put someone in a position where it's very difficult to care for their health. And creating agencies and institutions where sex workers are able to be sex workers and are still respected and still receive health care is a huge step, not only in terms of health, but in terms of social inclusion more broadly. And the fact that if you create a healthcare site that is welcoming of sex workers, it serves as a model for other sites to be more welcoming of people who are widely excluded and often isolated. And so, as we mentioned earlier, displaying a poster or pamphlets in support of sex workers in the waiting room can let people know where you stand even before they have an interaction with a provider. Engaging with local sex workers and local sex workers' rights groups is huge. And discussing sex work and reading and listening to or watching materials made by sex workers to learn more about sex workers' need from their healthcare providers goes a long way. And some resources that you can look to for more information are St. James Infirmary, the Sex Workers Outreach Project, which has local chapters in many U.S. cities, and SWOP Behind Bars is for currently or formerly incarcerated patients who are sex workers. Call Off Your Old Tired Ethics, Queens of the Underworld, and Pineapple Support both provide mental health care support for people involved in the sex industry. And additional information, again, can be found at some of the other sites sites mentioned, as well as the Global Network of Sex Workers Project, and the Lancet Special Series on Sex Work has some great research that was put out recently and is an entire special series dedicated to studying sex work. So here's some of the sources. These will be posted alongside these videos if you want to look at some of the studies that were mentioned throughout this more in depth. This is the end of this module. Next we'll be going over.
Bella, thank you. That was incredibly informative. Juliana did an amazing job with that. It seemed as though there are a lot of other organizations and individuals involved that we didn't discuss before. Would you like to tell us a little bit more about the module project and who all came together in a coalition or alliance to help to create this?
Absolutely. And with the 145 questions, it's a lot. We wanted to ensure that there wasn't things that we weren't thinking about. And even though I have 35 years experience, maybe someone's had an experience I haven't considered. So we collaborated with SWOP Behind Bars, Desiree Alliance, the St. James Infirmary, and over a dozen sex workers or people involved in the sex industry that had decades of experience. We also, during the slide deck, there'll be a link tree that will take you to all 3 modules because we only had time to show you one of the modules today.
Okay, I appreciate you having that information available for everybody. So that will be on the last slide of the slide deck that we're about to view now, yes?
Yes, thank you.
Okay, you are welcome. Okay, so understanding the experiences of sex workers within the continuum of healthcare in the United States. Sex work, an umbrella term that describes trading economic markers of value for sexual or erotic labor through performance or physical engagement. A sex worker is a person who performs the sexual or erotic labor. Sex trafficking is the involvement in the sex trade due to force, fraud, or coercion, or the involvement of a minor in the sex trade in any capacity. Experiences of sex workers within healthcare. What percentage of sex workers who participated in this poll disclosed their status as a sex worker? 42% said yes. 58%, however, said no. When asked, would disclosing sex worker status improve healthcare? 45% said yes. 25% said no. 30% said it depends on the provider, meaning how much they trust the provider that they are interacting with. And that's you. When asked about using condoms, 9% said never, only 9, whereas 78% said most often or always. 13% said rarely or sometimes. When asked about using condoms while not working, 42% shared that they almost always do. 37% said rarely or sometimes. And 20% said never. According to the Center for Disease Control 2017 survey, in condom use among what's defined as cisgender men, 47% said never, 34% said sometimes, 19% said always. In the CDC survey with condom use among cisgender women, 60% said never, 25% sometimes, and 15% always. Healthcare is a site of support. So we're asking for healthcare professionals, reflect on how your own personal beliefs and values on sex work may impact how you treat patients before discussing sex work in clinical interactions. If after reflection you find that you have beliefs and values, implicit or explicit, that may negatively impact service provisions, be comfortable that you may not be the appropriate provider for a particular patient, and be ready to refer them to either another provider or a different environment altogether. Be aware of partnering agencies' biases around sex work. When referring individuals to other agencies, do not out patients as sex workers without explicit permission. This can be a challenge. And that's where communication and creating baseline understandings of what is helpful and what is harmful is important. When referring individuals to other agencies, try to select support services that are educated about sex work and will not turn patients away. When patients have experienced violence, understand that police have been perpetuators of violence in many communities, and it may not be safe for sex workers to report their situations to the police. How to create safe environments for sex workers? Display posters or pamphlets in support of sex workers. Even if you don't support sex work, communicate that you support the sex worker. Engage with local sex workers. Discuss sex work, and read, listen, and watch materials made by sex workers to learn more about what sex workers need from their healthcare providers. For more information on this topic, reach out to Bella. Bella is available at Coyote, Rhode Island. Her website is www.coyoteri.org. That's www.coyoteri.org. She's available through email that is on that site, or bella@coyoteri.org. All of the continuing medical education materials and additional resources are available in what is called a link tree. This will be available to all people who request this information. Thank you very much to Blair Hopkins at SWOP Behind Bars for helping to create this material. My name is Melanie Goodman-Dante, and Bella, I thank you so much for allowing me the opportunity to make this presentation with you today.
Thank you, Melanie and Blair.